Hello there, and welcome to another episode of Meet the Press Reports. I'm Chuck Todd. Today we're going to look at the crisis of black maternity in America. Black women are far more likely than their white U.S. counterparts to die from pregnancy-related causes. And the difference is even greater compared to other high-income countries. In fact, the CDC points to inequities in healthcare, underlying chronic conditions, racism, and implicit bias as among the reasons for these disparities. And as you're going to see, often women work with a doula, a woman who advocates with doctors for the expecting mom. Well, today, NBC News correspondent and anchor Zincle Asamoah has a revealing and at times disturbing behind-the-scenes look at being pregnant and black in America. Zincle, what'd you find?
Hey, Chuck, thanks. Well, we found a lot. We actually met two women at the start of this year, both of them expecting, and we witnessed some of the most vulnerable moments of their lives, much of it captured through intimate home videos. Through the joys of preparing for a newborn to the sobering realities of labor pains, their stories offer a glimpse into what it's like in the U.S. being pregnant and black.
This is the story of two pregnant black women in 2023. Kanaya King in St. Louis, Missouri, and April Valentine in Inglewood, California. Their stories end very differently.
I have a baby, and she's so cute.
We all sat there hopeless and helpless.
And I said, what happened?
How did you and April meet?
I seen her, and it's like she lit up the room. She just came over there and told me, she was like, "You're gonna be my protector." And
She said that to you the first time you met.
yeah, the first time.
At 31 years old, April is pregnant with her first child. Nija is her partner and the father. He and one of April's older sisters, Keisha, will be in the room when she gives birth.
When she told me she wanted me to be in the room, you'd have to kind of know mine and April's relationship was like, I don't want to see
All that?
all of that. I'll just say all of that, right?
April met Stannis Askew, her doula, at 19 weeks. Birthing doulas are trained non-clinical professionals who support clients through pregnancy, labor, delivery, and postpartum.
April's birthing plan. Walk me through that.
Birthing plan is to have a natural birth. She doesn't have any risk factors. She understands the statistics. Black women in pregnancy and birth being 3 to 4 times more likely than a white counterpart to have complications in a birthing situation.
Stannis says the doctor, Gwen Allen, asked for her credentials and was on board.
You have some that are doula friendly, you have some that are not doula friendly.
And April's doctor is?
Yes. Claims to be, yes.
Robin Lloyd is Kanaya King's doula. 20 years ago, she had her own traumatic birthing experience.
The bed is saturated with blood. I'm completely covered.
So you were undergoing this traumatic experience where you're bleeding out and no one has told you what's happening.
No one has told me. Kanaya, this is our baby.
The scare led Robin to train to be a doula. She now works with a nonprofit where all of the doulas are women of color.
We sat down and we talked about, what she wanted to have in her birthing space. She said, Miss Robin, I just want you and me there.
The 23-year-old's pregnancy is high risk. She's nervous.
With my first two, I had a lot of complications.
But you were having a bunch of pressure though, right?
Usually you don't get ultrasounds every time you go to the hospital. I get an ultrasound every week, and sometimes 2 times a week.
Kanaya spends a lot of time with her doula, Robin, who also facilitates group classes. Tonight's gathering focusing on self-care for expecting moms.
I need help. I'm working on asking for it. I'm getting better at asking for it.
Kanaya's first child was born at 28 weeks and spent months in a neonatal intensive care unit. So this time, she's decided to get a cerclage. It involves placing stitches on the cervix to prevent it from opening too soon, which can result in a premature birth.
It's really important that if you're having any of these signs, we need to make sure that you call the doctor, then you call me.
Robin was Kanaya's doula for the birth of her first daughter, Alea. In labor, Kanaya got an infection and was hospitalized.
And I looked at Miss Robin, and she blatantly asked me, she was like, "Do you want your baby?" I said, "Yeah." And she's like, "Okay, we're gonna have a baby."
What are you feeling? Yeah. What are you feeling?
I'm very grateful for her. I'm very grateful for her. Because if she wasn't there, I don't know what would have happened with me or Elea.
And do you think you would be here and your kids would be here if you hadn't had a doula?
Not at all, no. Not at all.
It's Friday, January 6th. April reaches out to her doula, Stannis, for advice following a doctor's appointment.
She called me to say the doctor wanted to do induction. My first question to her is, why? Is your blood pressure up? She's like, no, everything is good.
By Monday, April is at 3 centimeters, and the family says Dr. Gwen Allen wants her to go to the hospital. There, April's sister, Keisha, grows concerned.
It looked run down. The walls were yellowing, and honestly, had kind of a weird smell.
It was just the beginning of their troubles at Centinela Hospital Medical Center's labor and delivery ward.
She calls and she says, they're not going to let you in.
Had that happened to you before as a doula?
No.
That's the whole reason she had picked that doctor, because the doctor black and she accepted doulas to be in the room.
Nija and Keisha stay beside April, who is now in pain, and they say despite multiple requests to nurses, Dr. Allen does not arrive or take their calls.
And she says, well, the doctor will cuss us out because she doesn't like us to call her over complaints like this.
About how many times do you think you all asked for the doctor?
More than 10. More than 10. More than 10 times.
Because Stannis is not allowed in the hospital, she supports April over video calls and text.
Ask why she had you come to the hospital.
Early Tuesday morning, April's pain is getting worse. Nija and Stannis say she gets an epidural.
April starts saying, I think my leg is swollen up. We go tell the nurse to come and check it out. The nurse says, oh no, that's normal.
She starts texting me. I don't know why they had me come here this early.
The family says Dr. Gwen Allen doesn't arrive until late Tuesday afternoon, nearly a day since April was admitted.
The doctor came in finally at like 4:30. When the doctor came in at 4:30, I was like, look what the wind done blew in. She just immediately didn't tell April what she was doing or nothing. Spread her legs, shoved her hand in there, snatched her fingers out. And water and stuff just started gushing out of April. I'm like, what you just do? She's like, oh, I just bust her water.
Dr. Allen leaves the room and doesn't return, according to the family. They say April continues to throw up and complain of pain. The nurse suggests pressing the epidural button for pain management.
After she did that, April started throwing up more. I'm coughing, I'm choking, but then it cuts off. It's like, right? And Nigel starts screaming. April, 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 April. He starts screaming out, she's not breathing. The nurse is frozen in place.
Nija starts CPR on April. Still, the family says no Dr. Allen. They say a nurse rushes in to give April an oxygen mask.
Her eyes got real watery and the tears just started coming down and they rolled to the back of her head. And she just hit the bed. And her body just went limp.
And he's saying, save my baby, save my girl. He's saying both of them, save my baby, save my girl.
Dr. Allen finally come in, she like, what's going on, what's going on, what happened?
Kanaya is due in a week and a half, but she and her doula, Robin, are at the hospital today.
We were concerned that her baby wasn't moving as he should be.
Kanaya's cervical stitches, the cerclage, are removed, so labor should be imminent. But she's not progressing, so doctors induce her.
And at this point, she hadn't had any, pain management because she was wanting to labor without an epidural.
But her labor continues for 14 hours. Kanaya reluctantly decides to get an epidural due to the severity of pain. There are no other complications, and on June 25th, 2023, Isaiah is born.
You seem to love being a mom.
Yes, I really do. I really do. I think God put you on this earth to do something. I think being a mom is my something.
Her third time around, Kanaya says her delivery experience was good, but it wasn't always this way.
I've noticed that with having babies, the doctors don't care what will happen to you as a Black woman. They weren't talking to me. They were talking amongst themselves, like I wasn't in the room and I was the one giving birth. I was just an object, it seemed like.
What do you think made the difference?
Miss Robin, actually, my doula, with her advocating for me and her talking to my doctors, having someone advocate for you when you're in that time where you cannot advocate for yourself means a lot. And I think every Black woman should have that.
It's been almost a full day since April was admitted to the hospital. Her doula, Stannis, is home and desperate for an update.
Radio silence. I'm like, hey, what's going on? Nothing. 3 o'clock, just checking in, nothing. 6 o'clock, I'm like, what is happening? And then her phone goes to silent. 11 o'clock p.m., my phone rings. April's phone's calling me. I'm like, April. And it's her sister. She says, no, Stannis, it's Keisha. And I said, what happened? She said, she didn't make it. April died. Initially, I thought, I don't want to do this. And then I thought,
You wanted to stop being a doula?
I wanted to stop being a doula. And then I thought, nope. I will do things to honor her. So
I hear the
she,
emotion.
yeah.
I had to kind of let go of this guilt, like I was there. And she wanted me there to protect her and to speak up for her. And sometimes I question, whether or not I did a good job at it.
You were present for her.
Was.
The LA County coroner ruled April's cause of death on January 10, 2023, a blood clot that likely traveled from her leg to her lung. The attorney for Valentine's attending physician, Dr. Gwen Allen, telling NBC News, Dr. Allen is prohibited by federal law from publicly commenting about her treatment of Miss Valentine. Dr. Allen, the attorney says, did not cause Miss Valentine's death. We reached out to the doctor multiple times for an interview, but the request was denied.
We will not give up!
The family has protested at Centinela regularly since April's passing, even filing a complaint with the LA County Board of Supervisors. In September, change came. Centinela Medical Center announcing it would shut down its labor and delivery ward, citing an exponential decrease in demand. The day of its closing marked by a vigil.
When people heard that they were closing down the hospital, some people were like, yeah. I was like, no, my sister would have never wanted that.
Why?
Because now where do you go have your baby? If you live in Inglewood, I think she would like for women to know that they have a choice. Because April at some point felt like she didn't have a choice.
Today, Anaya, Nija, and April's daughter is home in Inglewood. Anaya was delivered via crash C-section and lives with complications from the birth. Keisha and Stannis believe Anaya would not have made it had Nija not insisted she be saved.
How often do you come here?
I come Monday through Friday every morning. I have to stop by here because a piece of me still here.
I'm reminded that the first time you met April, you said you would be her protector.
Yes, ma'am. And I guess to this day, I'm gonna hold up like I made her a promise. I'm gonna keep it.
It's very difficult. Very difficult. So, obviously, not just protesting. There is a lawsuit. What's the status of that?
Yeah, it is difficult, and the family has chosen to take legal action, Chuck. April's partner, Nija, actually filed a civil lawsuit against Sentinella, the hospital, its staff, and Dr. Allen. Dr. Allen's attorneys say, in part, that she denies each, every, and all of the allegations contained in the complaint, adding it was the plaintiff's own negligence that caused the accident and any injury sustained. Now, the attorneys for Sentinella Hospital say all treatment was with the express and implied consent of April, and that she was aware of and accepted the risk. The hospital, meanwhile, says the damages allegedly sustained were caused by forces which were beyond the control of the hospital and the individuals named in that complaint, Chuck.
All right, they can say all that, but has there been an investigation?
Yeah, so the family filed a complaint with the LA County Board of Supervisors, and they investigated and cited many of the anecdotes that you heard from the family in that.
Obviously, shutting down Sentinella, that isn't what anybody wanted. They wanted better care.
Yeah.
So, but now we have no care.
Absolutely.
I mean, that seems like we're taking a step backwards here.
And my eyebrows went up, right? When April's sister, Keisha, said that to me. This is not a win. This is not what April would have wanted.
But I get that.
Yeah, because the community of Inglewood, California, Chuck, is about 15% persons in poverty and around 41% people of color. Right now, that means all of those people just lost access to a key health care resource.
And we focused here, and we're in Inglewood, California, but this is, and we're going to discuss it later in this program, this is a huge issue in rural America, isn't it?
Absolutely. There are maternity care deserts, not just in cities like Inglewood, but around the country. And the concern is simply closing hospitals like this means people have less and less access. And it's dangerous when you're in a vulnerable position like giving birth, like going into labor.
And it seems as if you really have to, if you don't have a rural hospital, you need to find a midwife or a doula.
Yeah, it's interesting that the popularity of doulas has increased. Now, data does show the presence of a doula improves health outcomes for women. So there are clear benefits. Of course, there's still conversations going on about, is health care going to cover, right, the cost of a doula? It's not always free for these women.
Not every state will cover it.
Right. So there's still a lot of work to be done to make sure a lot of people have access to what's been a key resource.
Tough story to do, but thank you for doing it. It's important to get it out there. Look, when we come back, I'm going to talk to two women who have studied the issue of black maternal health and what African-American women can do to have better birthing outcomes. Stay with us. Welcome back. We're joined now by two women who have spent considerable energy studying and writing about the black maternal mortality crisis here in the United States. Dr. Monique Rainford is an OBGYN and has written about how the disparities in healthcare impact black women. Dr. Rainford is the author of Pregnant While Black. And Elaine Welteroth is a journalist and author. She's written about how her decision to use a midwife for the birth of her son was the best decision she's ever made, and she joins us from Los Angeles. I appreciate you both being here. All right, Dr. Rainford, let's start with, is there any biological difference between white women and black women when it comes to giving birth?
That's a loaded question in a way. Genetically, when we talk about the genetics we were given, no.
Right.
But has racism or chronic stresses had an effect on our biology? Yes. It has accelerated the aging of black women by 7.5 to 10 years because of chronic stressors. And so a black woman at 25 years old may have the biological age of 35 years old.
Is this what you refer to as weathering?
Weathering.
Yes.
That's a great term, and Arlene Geronimus coined that term.
Basically, so that it is, you're just if the average woman has an at-risk pregnancy supposedly starting at the age 35, what you're saying is that a black woman at, say, 27 is an at-risk pregnancy. Is that another way of looking at it?
That is another way of looking at it, yes, and that is only part of the story.
So why then, what would be your explanation for why black women are 3 times more likely to die in childbirth?
Part of it is because of this premature aging, for societal factors actually. Another part of it would be how they are treated when they get into an institution of care. Another part of it would be the lack of quality of some of the places where they have to get care. Another part of it will be that when they have concerns, they're not listened to. Another part of it would be that they come in not prepared for pregnancy medically because they don't have access to enough care before they get pregnant.
They haven't done the 1-month check, the 3-month check, whatever it is, all of it,
well,
you know,
not
because they haven't
really.
had access to it?
Well, not even the 1-month check. So if you go into pregnancy and you have a health condition, you need to go into pregnancy healthier.
Right.
You need to have care before. Guess what? If you don't have any insurance before you get pregnant, you cannot get care before pregnancy. Right. Or if your access is limited because of the type of insurance that you have.
So this is obviously a very American issue, because when you look at these birth rates, both maternal mortality rates here in this country, white and black, are much higher than the Netherlands, Japan, the United Kingdom, Canada. What would be that explanation?
So some of it is, you talked about in the story earlier, like some hospitals closing, lack of access, the maternity deserts. So even if women want to get care, even if they have some of the resources, their only option may be a hospital that doesn't have an obstetric provider of any sort. And so that obstetric provider may not know the right things they need to know to care for the women. And it takes too long to get to the facility that can give them the care they need, and that can be deadly.
Let me shift to Elaine Welteroth here. You wrote about the decision to go with a midwife, and hearing everything Dr. Rainford just said, it almost seems as if every pregnant black woman in America ought to get a midwife. Tell me why you think it was the best decision you ever made.
Well, first of all, thank you so much for having me, and thank you for shining a light on this issue that unfortunately we don't think about enough or talk about enough until it's too late. I will say that I feel incredibly fortunate to have had the awareness that midwifery care could be an alternative option that could make me feel safer going through my pregnancy journey and certainly through my delivery experience. I'm someone who, I have access to all of the best resources here in LA, and I thought I wouldn't have trouble finding a doctor in, the traditional medical care system that that's been normalized for me to have my baby in. And unfortunately, it was incredibly challenging for me to find a doctor that made me feel safe, understood, listened to. I had incredibly difficult, painful experiences with doctors. I ended up going through a series of doctors, just dating different doctors to try to find someone that made me feel safe, especially in the face of this looming crisis, maternal mortality crisis that we're in, that I knew disproportionately impacts black women. So when I learned about this alternative, by that point, I was so disheartened by the experience I've had with doctors, that I was more open-minded to it. And when I tell you the care that I received, there was a night and day difference. The appointments at the doctors were 15 minutes, maybe max. I was literally told by a doctor that I could ask max 2 to 3 questions. I was rushed out of appointments. I was belittled. I was talked down to. I'm an educated black woman, and I was belittled in the presence of doctors. When I came under the care of Kindred Space LA, under the care of Kimberly Durden, who's one of the co-founders, she spent at times over an hour with me. She talked to me about my holistic health, my diet, my relationships, my mental health, my emotional health. She went deeper with me than any doctor had ever done, and really equipped me with a sense of self-trust in my body and in this process, and to the point where by 36 weeks I agreed to do a home birth. And for me, that was a huge leap to get there. But for me, it felt like the safest option, and I'm really blessed to say that I had not just a safe birth, but I had a beautiful, joyful birth. And I share my story to empower other women to explore alternative options if you're not finding the care you need in the traditional medical care system.
Elaine, if you don't mind, explain what the difference is between a midwife and a doula.
I'm glad you asked, because I think there's a lot of confusion around that. So effectively, midwives are there to help catch the baby. They are there to give you prenatal and postnatal health care. They attend to your needs just like a doctor does. A doula, however, is there for the mother. So in the birthing room, the midwives are there for the baby primarily, and the doula is there primarily for the mother. They are there all throughout the pregnancy journey to coach the mother through all of what can come up during pregnancy. They're there to help with nutrition. They are there to prep the mother for birth. They're there as emotional support, mental support. You know, pregnancy is a very isolating time. It's a very overwhelming time. And so they're there also, most importantly, they're there as your advocates in the birthing room. If you are delivering in a hospital system, the doula comes with you, and they attend to you. They are right by your side to be your biggest advocate in the room.
Dr. Rainford, how would you advise a woman? Would you to do a midwife, to do a doula? Is there a specific circumstance you should go down that road, or should that always be the path someone takes?
The best scenarios I've seen of my career is when midwives and doctors work together. If you have that relationship, if a woman is higher risk, has more high-risk issues, and she needs an obstetrician, then when you have that partnership, she can have the benefits of midwifery care and the benefits of the expertise of an obstetrician.
How often are OBGYNs open to working with midwives?
I think more often than you might think.
Okay.
Because in the center I work with, we work with midwives all the time and advanced practice practitioners. And I've worked with midwives throughout my whole career. There are some women who go into pregnancy more high risk, and they may need physicians from the beginning of pregnancy. If they're lower risk, then they can have midwives. And as I said, the sweet spot sometimes if they have the benefits of both, and sometimes that can be available for some women depending on their risk factors.
Elaine, look, you obviously did a lot of your own research. You were concerned. Do you feel like we need to educate people about the availability of midwives and doulas? I mean, I think a lot of young women may not know about that this is an alternative way or a more personalized way to go through this process.
Absolutely. Absolutely. I'm here to tell my story for that exact reason. I think we need to expose birthing people in this country to all of their options and educate them on all of their options. And also there needs to be, frankly, a cultural shift to normalize some of these out-of-hospital options that are providing greater
You wrote about
care,
this. There has been this sort of,
women.
there is a weird stigma that comes with birthing at home, right? I think you even said, oh, it's the, the crunchy granola, right? And it turned out that's sort of an intentional myth that's out there, isn't it?
Absolutely. Listen, I will be the first to say I didn't think about having a home birth. My mother, my grandmother, most of the people I know have all had births in the hospital. So I am the perfect sort of candidate to say I misunderstood what it meant to be a mom who gives birth out of the hospital with a midwife and doula support. I had to educate myself about this option, and I had to kind of deconstruct some of the stereotypes that I associated with home birth and with midwives. But what I came to understand as I unpacked this issue and looked at it through a historical lens is all of the myths that we hold in our mind around midwives being the lesser safe option,
Right.
them being sort of a hippie freestyle alternative path of mothering that maybe is only for these sort of, as you say, granola moms. Those are deliberate, constructed ideas that are part of the propaganda that was used to eliminate midwifery care from this country. And when you actually go back, you realize that midwifery care gave birth to this nation.
Sure.
This is the original
We didn't have a lot of
way
hospitals in
that
the
folks
18th
gave
century
birth.
or the 19th century. There weren't a lot of maternity wards, right? I mean, this was the only way.
Exactly.
Yeah.
Exactly. And when you look at the introduction of obstetrics, the maternal death rate has only skyrocketed since the introduction of obstetrics. So it's important that we deconstruct why we think of midwifery care and out-of-hospital births as less safe when the data does not support that.
Final question for you, Dr. Rainford. It's clear we have an access issue. And I guess the question is this an access, is this a rural hospital issue? Is this not enough OBGYNs, not enough OBGYNs of color? What's line item one here of trying to solve?
I think it's all of the above, but certainly we need to train more OBGYNs of color. We need to train more midwives of color. We need more doulas to support our women. So we definitely need all that. And then we have to look at the hospitals that we have. We have to make sure the quality is great in those hospitals. We can't have substandard quality because we'll have bad results. So many facets.
Absolutely. Monique Rainford, Elaine Walter-Roth, thank you both for sharing your expertise and your personal stories on this. That's all we have for this episode of Meet the Press Reports. On the next episode, we're going to look at college student athletes who for decades made billions in profits for their schools are finally being allowed to make money for themselves. What that could mean for the future of college sports and why Congress may have to get involved. That's next time on Meet the Press Reports.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.